ADPIE is a structured nursing process that helps nurses organize patient-centered care. Instead of treating care as isolated tasks, it connects data collection, clinical judgment, planning, action, and evaluation within one continuous cycle. The letters stand for assessment, diagnosis, planning, implementation, and evaluation. A DPIE is often pronounced ADPIE. Each phase builds on the information and decisions from the phase before it, while new findings can lead back to reassessment. Using the nursing process supports organized, consistent, and accountable care. It helps nurses recognize patient needs, set priorities, communicate with the healthcare team, choose appropriate interventions, and check whether the plan is producing the intended results. Assessment begins as soon as the nurse encounters the patient. The goal is to collect complete, relevant information about current concerns, health history, physical condition, daily function, emotional state, and possible safety risks. Subjective data are what the patient or caregiver reports. The nurse uses open questions and active listening to explore symptoms, concerns, health history, medications, routines, and what matters most to the patient. Objective data are findings the nurse can observe or measure. Examples include temperature, pulse, breathing rate, blood pressure, oxygen saturation, appearance, behavior, mobility, and relevant results already available in the clinical record. A complete assessment looks beyond one symptom. It considers physiological, psychological, sociocultural, spiritual, economic, and lifestyle factors because each can affect the patient's needs, choices, risks, and response to care. Assessment findings should be validated when something seems unclear or inconsistent. The nurse then documents relevant data accurately and promptly so changes can be tracked and the care team can work from the same information. During diagnosis, the nurse groups related assessment cues, looks for patterns, and applies clinical judgment. The result is a nursing diagnosis describing a patient response, need, or vulnerability that nursing care can address. A medical diagnosis identifies a disease, such as pneumonia. A nursing diagnosis focuses on how the patient responds or may be affected. For example, difficulty clearing the airway, anxiety, impaired mobility, or risk for injury. Next, the nurse prioritizes the identified needs. Immediate threats to safety and stability come first, followed by urgent actual problems and important risks. Priorities must be reviewed again whenever the patient's condition changes. Planning turns priorities into measurable, achievable outcomes. The nurse defines what improvement should look like and by when, using short-term goals for immediate progress and longer-term goals for recovery, independence, or discharge. Good planning is collaborative. The nurse involves the patient, considers personal preferences and abilities, and coordinates with the healthcare team. Shared goals make the care plan more realistic, understandable, and meaningful. For each outcome, the nurse selects appropriate interventions and records when, how, and by whom they will be performed. Every intervention should connect to an identified need and have a clear clinical rationale. Implementation is the action phase. The nurse performs, coordinates, delegates, or supports interventions within the care plan and scope of practice. This may include direct care, medication administration, teaching, safety measures, communication, and documentation. Implementation also includes watching the patient's response. The nurse reassesses symptoms, vital signs, comfort, function, and safety, documents what occurred, and communicates unexpected changes so the plan can be adjusted promptly. During evaluation, the nurse compares the patient's current status with the planned outcomes. An outcome may be met, partly met, or not met. The nurse also judges whether the interventions were effective. Evaluation does not end the process. Based on the patient's response, the nurse may continue the plan, modify goals or interventions, or close a resolved problem. A DPIE remains a dynamic, repeating cycle of care.